We're back with your health. This morning, the new rule starting in 2019 requiring hospitals to post online how much procedures will cost you.
But some healthcare advocates warn it's not quite as straightforward as it sounds and may actually hurt consumers. Here to break it down for us, NBC News medical contributor, Dr. Natalie Azar. Dr. Natalie, always good to see you.
Good morning.
And so on the surface, one would assume that transparency is a good thing.
Absolutely.
First of all, what does the new law require?
So current law requires that hospitals at least make publicly accessible their charges. So if that's requested, a hospital is able to provide that. The new rule is stating as of January 1st that hospitals have to actually list their service charges online on the internet in a format that's called machine readable for you computer people out there. So it's not like a PDF. And this is basically the new law that's going into effect.
And that's the price for the patient? Is that without insurance? I feel like it could get complicated.
This is where it gets complicated. So this is something called a charge master list. So this is the list price. You know, when you go to buy a car, for example, right? You have a manufacturer's suggested retail price. This is basically what it is. But the big problem here and what the concern is that there's a big difference between what the list price is and what the actual transaction price is, aka the price that the patient is responsible for or the cost that the patient is responsible for. And therein comes the whole issue with insurance, right? We know these things, these dirty words called copays, co-insurance, and deductibles. So there's a lot of negotiating that happens. So the list price in and of itself may not actually be that meaningful to a patient because they still have to go back to their insurance company and find out actually what their patient responsibility is going to be.
Is this going to at all drive down the cost of any of these services or procedures?
So again, the whole philosophy behind this transparency is that it's going to improve competition, right? If you can shop around and say, wow, well, you know what, this hospital is offering me a lower price for a colonoscopy than this one, that at the end of the day, it's going to make a very educated consumer and drive down costs. There was a study that looked at this a couple of years ago, and in fact, that didn't really pan out so much. There's sort of cost inflation across the board, hospitals and providers and everything, so it didn't really seem to make a big dent. But I do want to say that philosophically, it's a good thing, right? That if you have the ability to plan for something, that you might be able to cost compare. But what about emergency room situations?
Well, that's the thing. It's not like you're hurting and you're going to go Google and see how much it's going to cost me to go around the corner.
Absolutely. Or if you're in a critically ill situation, you're not going to be able to negotiate on your behalf. So definitely a couple places where we see a lot of loopholes in here and doesn't sound as great as it might on the surface. But I think it's a move in the right direction for transparency.
Well, what's the best way to be informed before a procedure?
A procedure. Well, I mean, I definitely think that everyone should know that they can find out price. They can already find out prices. Now, ostensibly, it's going to be a little bit easier to, but this is where you need to have open communication with your provider. You need to think about not only the cost of something, but also a safety record, right? Is the location, the quality of care at the place that you're going.
That's another whole piece.
Right?
That's right.
There's a lot of pieces to this. And again, if you have time to plan for something, I think you can make some really smart decisions. But in the situation where there's not time for planning, as patients learn the hard way, oops, that wasn't covered. You know, that I'm not sure how that's going to necessarily be remedied by this.
But I guess it's a start.
I think it's a start. And I applaud them for doing it.
Dr. Natalie Azar, thank you so much.